Hi, everybody. Welcome. I'm Russ Diamond, president of Snyder Diamond, and I wanted to thank you for joining us this evening for the Zoom broadcast, and the first of many, as we hope to inform and educate with this presentation. As we find ourselves sheltering in place amidst the most devastating health and economic challenge of our times, we at Snyder Diamond just wanted to do something to help us all get through this nightmare. Even if that something seems a little small, subtle, or even trivial, it just might provide some important and needed benefits for all of us. With our continued focus at Snyder Diamond on health and wellness, we have begun a collaboration with INI, the Institute for Neuro Innovation, and Neurovella Brain Spa, which is based right here in Santa Monica. With us today, and you'll meet him soon, is the founder and CEO, renowned neurosurgeon, Dr. Amir Vokshoor, who will guide us through an exercise of diaphragmatic breathing. Now, this is a very simple yet effective method of improving mental and physical health. Most importantly, especially during this time, it may help temper the stress and anxiety that we are all currently feeling. So to now share with you, I want to introduce, and it is my pleasure to welcome Dr. Amir Vokshoor. Doc?
Thank you so much, Russ. It's a pleasure and honor to be here. And it's really a sign of interesting times where we have this many participants on a video call, just trying to get some time to relax and breathe. So it's very, very apropos that we're fighting a terrible pathogen that actually insults and aggravates our lungs more than anything else. And one of our biggest weapons against it is to strengthen our pulmonary system, our immune system, and sort of the balance between under immunity and over immunity, which is a constant battle in any body that is trying to fight infections. Because as we know, one of the terrible things that can happen as a result of this virus is the overreaction of the immune system against it, which actually causes a terrible lung disease and ends in pulmonary fibrosis. So I'm a practicing neurosurgeon. My day job is actually operating on brains and spines to relieve people from anything from cancer to severe arm and leg pain. I feel absolutely privileged to do what I do on a daily basis. And one of the things I've always wanted to do is to round out our neurosurgical practice into getting more holistic, more integrative, and really more about the entire continuum of health, including things that are, really hot off the press right now. For example, the gut-brain axis that affects the immune system, the breath work that's being done to decrease anxiety and stress. So we started this project over 2 years ago. The Neurovella Brain Spa was sort of my brainchild in saying, okay, let's put everything that works in neuroscience from the least invasive to the most in one place, incubate these ideas and see what we come up with. And one of the things that we worked on the less invasive side was breath work. So that's what we'll concentrate on today. Diaphragmatic breathing is nothing new. There is a technique that we'll go through, and Jennifer has been kind enough to be our guinea pig for this experiment. She will do the actual breath exercises that I will instruct her on. And we think it not only affects the autonomic nervous system, but it affects things like the resilience of the body, as well as, and this is not a claim that I'm willing to make lightly, but it could modulate the immune system as well through an exercise discipline, deep breathing that one can do every day. And it's very accessible. I have been also dabbling in meditation, and this certainly crosses over to a meditative practice as well, but it doesn't have to be meditative. It can simply be you improving your physiology by deep breathing on a daily basis. And this is something that I recommend to my patients in the postoperative period, or if they're going through a rough patch of inflammation and pain. So did you guys want to, Bill or Jennifer, did you guys want to chime in a little bit about the exercises?
I just want to say hi to everybody and thanks for joining in with us, and thank you so much for taking your time out of your busy schedule to share that with us and our community. And yeah, I think we're ready to get started if you're ready. Yeah.
Wonderful.
Can you guys we have to fix the view just really quickly. We just need to make it so that it's just you two. So just
okay. So I'll just say we're going to go through this breath exercise. It's not very long. It takes we're just going to be doing a few minutes, right?
Yes, and I'll give some I'll talk about the technique a little bit in detail before we start it.
Okay. And after that we'll open up the Q&A for everyone if you have questions, if you haven't, anything that you want to ask the doctor, we'll open that up for questions after we're finished with the breath exercise. And did you get the screen ready, Jennifer?
So I'll just start talking about the technique a little bit. So basically what we worked on, we actually had a pharmacist visiting us from Lyon, France, and they're historically one of the best sources of science in hypnotic sciences or self-hypnotism. And he started talking about suggestive language that you can literally tell yourself. In the beginning, it made me chuckle a little bit. It made me feel like it's almost comical when you're just trying to give yourself self-affirmations on a daily basis. But when I looked into the science, it's actually there. And so we incorporated part of the suggestive affirmations into the breathing technique, as well as this concept of setting an intention, which I still call like the X factor of the nervous system. And Jennifer will guide us to that as we start to practice. But basically, the way the nervous system interacts with our willpower, our manifestation of our own reality, is under extremely hot debate in science about whether we actually have free will or whether it's completely kind of thermodynamically preordained. And that's, it's a topic of my research passion, as well as, it crosses over religion and philosophy and spirituality, et cetera. But the most important part that applies here is that we want to use a very simple physiologic technique to improve our resilience. And we have a three-part thing at Neurovella that we say it starts with mindset, and then breath, and resilience. So we go from setting an intention to doing the practice as much as possible, like a daily practice would be ideal. And that the measure in resilience is something that we're after to see if these methods actually improve resilience. So as our first exercise today, we're simply going to count breaths from 100 to 70. It's very short exercise. And we're going to inhale on the even numbers, like 100, 98, 96. We're going to exhale on the odd numbers. I'm going to count slowly so your lung can fill and stay filled as much as possible. And the key with diaphragmatic breathing is here, I'll make it a little bit lower, is you can actually measure every breath that you take. You can put your one hand on the chest and one hand on your belly button. And every breath that you take, you can measure the excursion, the expansion of the chest versus the belly. The diaphragm is this extremely large, thin muscle that separates the chest cavity from the abdominal cavity. And in the most efficient breathing, we use the entire diaphragmatic descent to go from chest down to the belly, we actually fill the most amount of alveoli, the little lung sacs, with air. And that's the goal of diaphragmatic breathing. It's not supposed to be super effortful. It's supposed to make you an efficient breather, so you oxygenate as much as possible. And so the technique is that you put one hand on your chest and one hand on your belly if you haven't tried it, and simply breathe and try to get as much movement in the belly hand and the least amount of movement in your chest hand. So one inhale, and exhale. And my chest hand moved very little. And, at the risk of showing you my belly, this hand moved a lot. So that's the technique. And that's diaphragmatic breathing in a nutshell. Now, there is other techniques like holotropic breathing and the Wim Hof method, et cetera, that we've also incorporated a little bit in our countdown. We won't go too into detail on that, but as we get more advanced in this practice, and I believe there will be another more advanced exercise next week, we can delve into that and talk about those. So Jennifer, you ready?
I think so. Yeah. And it looks like they got the screen so that you and I are split. So I think we're good.
Great.
It might take me a minute to get adjusted with a good angle because I know we want to see like me from the waist up, right?
Right. Another reminder for everyone here is that the more reclined you are, the less effortful the practice will be. You can literally do it lying down. Obviously, you might fall asleep, and that's okay too.
Okay, or do you want me to adjust more?
No, that's fine. That's great. That's great. So we're going to start to count down now. And the more upright you are, the more energy this practice gives you. So I always tell my patients to do the upright practice in the morning when you're just trying to get energy, and do the more reclined practice later during the day when you're trying to relax. So it can actually be utilized for both purposes. So yes, I would love for you to close your eyes. Another little tidbit of the technique is that during inhales, with your eyes closed, you look upward. What the meditators say, look into your third eye or imagine your forehead. And during the exhales, you look downward. And so, Jennifer, you want to start by setting an intention or guiding us through one?
Yes. Well, I think we would, at Snyder Diamond, we want to set an intention of just collective health and wellness for all of us and our community and our world. So that's kind of the purpose of why we wanted to put on this event, because we want to bring some comfort and some sort of action that people can take if they're feeling anxious or they're scared. So that would be Snyder Diamond's overall intention, and then we'll maybe give a few seconds for everyone who's on the call and for myself to make our own individual intention.
That's a great idea.
Okay, I'm ready when you are.
So one of the intentions that I like to set as an example is I'd like to remove all constraints from my conscious and subconscious to delve deeper into this. And there's a constant dance between attending too much, focusing too much, and then the unfocused state. And all I want you to do is to try to focus on the breath if your attention gets distracted. And let's start. So with the first inhale, with eyes closed, you look up and I start to count. 100, 99, 98, 97, 96, 95, 94, 93, 92, 91, 90, 89, 88, 87, 86, 85, 84, 83, 82, 81, 80, 79, 78, 77, 76, 75, 74, 73, 72, 71, 70. Now, with every breath, you can dive deeper and deeper, and you can count all the way down to 0 if you like on your own. And we usually use suggestive languages that verbiage between 70, 50, 30, and 10, and then at 0. Jennifer, how are you feeling?
Feel good. Relaxed.
Was that a reasonable pace? Was it too fast?
I like that pace. My question, you had said you had talked a little about the Wim Hof breathing, or I can't remember the technical word for it.
The holotropic.
And you mentioned, what's it?
With the holotropic method?
Yes. And you had mentioned when we spoke the other day that you like to implement that. Is there a reason that would you typically do this much faster, and what's the reasoning?
So there is a physiologic hyperventilation that goes on with those types of breathing that hyperoxygenate you. And we know, sorry about the computer sound, we know from pro athletes, pro surfers, people that train in, for example, deep ocean diving, that it has incredible physiologic effects on the lung if you can practice those things and use them for breath holding exercises. So we're dabbling in that. And another reason is, Wim Hof is sort of this anomaly. I don't know if you guys have heard of him, but he's this anomaly of immunity. So his immune system is actually different because of the breath practice. And that's why I'm so excited about introducing his kind of breath work into our diaphragmatic method.
Yeah, I know a little about him, and that it's completely fascinating what he can do and his capability of how long he can hold his breath and the temperatures he can withstand. It's fascinating.
One of the attendings had a great question that do you push your tummy out when you breathe in or you breathe out, and the tummy is released to go out. Your abdomen actually naturally goes out as the diaphragm comes in, and the least amount of resistance is needed to just allow your stomach muscles to relax enough for your belly to go out. You actually feel the belly expand. But on your exhales, one of the things that I've done, and I forgot to mention, is I actually use my stomach muscles, and I even purse my lips a little bit in the beginning to exhale a little with a little bit of force to actually empty the lungs as much as possible. So you can use your abdominal muscles during your exhales and absolute relaxation during the inhale. And that you actually see your belly rise that way. So hopefully that covers that question.
I have a breathing question.
Okay, John.
Yeah, I heard both nose breathing and mouth breathing. Is there a suggested way, or do you do both, or one or the other?
We usually start with mouth breathing in the beginning, and as you get better and better practiced, it becomes almost like a yogi breath where it's all done through the nose. This is usually a 6-week exercise, and the first week, from when you're counting just from 100 to 70 over and over for the first week, you can use your mouth if you feel comfortable. I kind of combined it there as I just felt like I needed to mouth breathe a little more today, but usually I do complete nose breathing because I have done this for a while now.
Thank you.
Of course.
Anybody else with some questions? We'd love to hear from you.
Yes, I have a question. There's a lot of talk about the so-called breath work, where you do a two-part breathing through, the first part is through your belly and then your chest and then out your mouth, and it's also an open-mouthed breathing. From your research, Dr. Amir, have you seen any results with that on the nervous system or immune system?
I mean, there's so many examples of it. I know that, for example, even the Marines and the Special Forces have their own way of breath work, which they call the fours, I think 4x4 or something of that sort. So there's also 4-3-8, where you inhale for 4, hold for, 4-7-8. You inhale for 4 seconds, hold for 7, and then exhale for 8. So those are extremely powerful methods. I would say all of them are powerful. I don't think scientifically we've doled out which one is a little bit better than the other. I think it has to do with your vital capacity. Any sort of this kind of breath work increases your vital capacity, hyperoxygenates your cells, and I think actually affects immunity that way. But anything from the diaphragmatic part, which actually gets to the base of the lung, to the chest exertion, because you're actually using the accessory muscles of breathing, to the mouth, which clears your airway and your nasal passage, your oropharynx and nasopharynx, is, I think, really important.
Well, and I find that I'm not as consistent as I'd like to be with my meditation practice, but when I'm doing it, I realize how little I'm actually breathing most of the time, how it's just very shallow. And so I think just taking the time to
I think most of our life is an overdrive of the sympathetic nervous system. Watching myself today trying to just get done with work so I could actually come do this, and watching Russ dealing with last minute phone calls just reminded me of how our day is filled with an overdrive of cortisol and stress hormones.
Yes. Gloria, do you have a question?
I think there's something wrong.
Yeah, we're not catching that. Gloria, we couldn't hear you. You might want to write your question in, because we're not able to hear you.
Okay, I have a question. I got it a little bit on this, and my question is, are you saying you do a set of 100 in the morning and a set of 100 in the evening?
Can you hear me okay?
Yes.
Okay, something's going on with someone else's phone. Okay, so I personally do the 100 to 1 in the morning, and the evening just depends on my energy level.
Okay, thank you.
Yeah.
And just to further on that, hang on one sec. I'm letting them know that we're having a little sound. Oh, Jill, you have a question?
So there was a couple of new questions came. One is that in a freezing climate, is it bad to deeply inhale? And I do not think it's bad for the lungs to deeply inhale. I think you can do deep breathing in the cold. Wim Hof, WIMHOFF, Wim Hof.
Okay. And just to go back to go further on the question previous of if you do it once in the morning and once in the evening, I mean, you could really do this as many times as you wanted throughout the day. Are there physical benefits of doing it more times per day? Or is there a limit of when it's like you can do it, but it's not doing anything for you beyond that?
You know, I think that's the question we're after. We're actually trying to put a resilience meter on the Neurovella app, the prototype of which is just about this, is to say if you practice this on a daily basis at least once a day, what are your physiologic effects on your resilience? And I invite everyone to get on neurovella.com and connect with us. Our facilitator Paloma is happy to walk you through your own personal breathwork session through a Neurovella as well. And you can do the entire 6 weeks if you like. Bill has some experience as one of our breathwork clients, and he went through the entire 6 weeks, and he's gotten more advanced to the point that he only does 10 breaths now, but 10 really deep breaths that count from 100 to 1 all the way. And that's what we're trying to do next week during our session.
So Bill, can you tell us about your experience a little bit?
I do it every morning without fail. It takes roughly 5 to 8 minutes. I face each day differently. It doesn't matter. Just before I start the day, the work day, I feel a lightness and a clarity that I have never felt before on a consistent basis. And so for me, it's become a habit as instinctive as brushing my teeth in the morning. And it works. It works. I can't comment clinically on what it's doing to my lungs or my immune system. I can tell you my overall mood has improved and mellowed. I've always dealt with stress. I deal with it more effectively now than I ever have. And I can't say enough good things about it. And I've never seen anything work consistently with just good concentration, good habits, and done in so little time.
And when did you go through the program, Bill? How long ago?
I think probably 6 months ago, doctor.
Yes, I believe so.
Yeah.
And it's a 6-week session
I
program.
went through the entire 6 weeks of going from 100 to 0 in stages. And then from there, we went to the advanced. And there was absolutely no difficulty or strain in making the transition. I work out and I do other things, but this has been just something I now look at as an instinctive part of my day.
I think the simplicity of this tool is the most important part of it. You can have the 6 weeks of training for yourself, or you can just simply, do it on your own and get a week of training. So there's a lot of great material on this. And I do believe that this time where we have this horrible virus trying to attack our lungs is a great opportune time for us to look more inward and strengthen our immunity, strengthen our resilience. And I think this is a very simple and available method to everyone. At Neurovella, we do it on a recliner chair that also gives slight amount of haptic stimulation to the back. So it's a lot more of what we consider the brain spa experience. But we can now do virtual breathwork sessions as well. And our facilitator, Paloma Santos, is happy to do that for anyone who wants to do it. Just contact her through the neurovella.com brain spa website.
Great. We have a couple more written questions. Jon Cunningham is asking, will continued use increase your blood oxygen levels?
Yes, that's actually the goal of it. So as you know, the blood oxygen level curve has to do with your oxygen carrying capacity. And the diaphragmatic breathing is the most efficient way of increasing your blood oxygen levels. So you asked, I think Mr. Sohal asked about asthma. It really depends on whether you're inflamed or not during asthma. So I would say deep breathing is really good if your airways are not actively inflamed. Otherwise, there's a lot of coughing and irritation. Also, breathing good air is really important. We thankfully now, LA right now enjoys one of the cleanest airs it ever has. And right now is actually a good time to open the window and breathe. A lot of times it didn't used to be like this. Air filters and filtration systems do help. So I think that's another, part of the equation is how oxygenated is the air that you're breathing. But absolutely, you get hyperoxygenated this way. And with the rapid breathing method, I used to do it based on our brain spa method, but a little bit faster. And it actually induces almost a psychedelic journey. And that's the goal of the holotropic method. It was actually initially developed after the 60s when LSD became illegal. That's how holotropic breath work started. And I've talked to a few of those practitioners. I was dumbfounded that breath work could actually induce those states. But that's how powerful our nervous system is and how interactive it is with our cardiopulmonary system. This affects your heart rate, for example. And we know that heart rate variability is tied to some resilience markers that we're working on. So these biomarkers of heart rate variability, your blood pressure, your temperature, your galvanic skin response, a lot of biomarkers can be modulated and improved upon with this type of work.
Interesting. M. Lewis is asking, and I was actually going to ask a similar question to this, do breathing exercises help clear lungs, like bring anything up that's trapped in there?
Absolutely.
To further on to that, I read somewhere that someone who was suffering from COVID said that the way they were fighting through it was doing exactly the opposite of what you feel like doing and forcing himself to breathe, even though he could barely breathe, and forcing himself to sit up and working those lungs, even though it was so difficult to do. Is there some correlation there?
I think that goes to the asthma question. I would say COVID is a little different because asthma is going to go through waves and get better. COVID may not get better, in which case you're really fighting for air. And I think if you can muster enough energy to do that, it can be painful and irritating, but absolutely, I think that's a fantastic idea. And another question had to do with the affirmations. There are a few ways of doing it. For example, Bill worked with our previous facilitator and the French pharmacy PhD fellow that spent time with us. The suggestive language has been designed to be neuroscientifically valid. However, it's a lot of the evidence is anecdotal. So we came up with some simple affirmations that we shortened for our American audience because the French words were just long sentences. So basically at the beginning, we set an intention. Mine has to do with getting the constraints out of my subconscious and conscious mind. And then at 70, you delve in a little deeper. At 50, I talk about things that I'd like to release, things that are no longer of service to me. And it can be anything from negativity to bitterness to guilt, things from childhood, whatever you have some insight about your pain points. And then at 30, we usually try to invite things like serenity and peace and clarity. And then at 10 to 0, you kind of go into your own thing. You can say things like, I will get better with this every day. Or what Bill likes to say, and he taught me this, is just clarity and more clarity. Right, Bill?
Yes.
Excellent. Hi, Roxy.
Hi. Is it showing my face?
This is no, but we don't. The only faces showing are the panelists for for this meeting.
Good, because I'm not Zoom ready.
Okay. I'm sure you are. This is right up your alley. What's your question? Or
Oh,
comment?
I'm so sorry. I didn't realize I had a question. I'm loving this. No, it is
Oh.
very much in line what I also believe. So yes, no, I'm just listening away.
Okay. Well, thanks for joining us. And
Thank you. And I'm glad Bill shaved. Bill looks Zoom ready.
This is the cleanest I've been in weeks.
And I want to personally thank Snyder Diamond, Russ, for organizing this. The biggest disclaimer is I'm certainly don't consider myself some kind of a guru or, you know, someone to follow from a meditative standpoint. I really just believe in this, and I recommend it to my patients because I want them to do better physiologically, feel better, and this can decrease pain and increase wellness. This in very basic terms.
we really appreciate, we know you're very, very busy. So we appreciate you taking the time and sharing your knowledge. And
Okay.
oh, I want to make sure everybody knows we're doing this again next Wednesday at 5 o'clock. Please come because it goes further into the practice. So there's, you know, as the doctor was saying, there's more to it and there's more steps. And so it'll be beneficial for you to follow along, and we can all be practicing this on our own for the next week. And then we'll be at that next level where we're going to be ready to learn the rest of the practice. And before we go, we do get, we had a couple of more comments. In Lewis, you'll get an email. Well, or actually, I think the way we did it this time, we'll blast an invite that has an RSVP for you, and then you'll get the link so that you can join. So if you...
And let's make a homework assignment of everyone just repeating this exercise if they can on a daily basis, and even count lower if you feel like it. Just be in a reclined position. If you're counting too fast, and that's very common in the beginning, you can get lightheaded. You can have the holotropic experience. So just be warned.
Okay. All right. Any more? Oh, wait. Let's just, looks like we have a couple more comments or questions. There will be another invite, Jon Cunningham. And is there a good place for countdown, to listen to countdown? I'm not sure I quite.
Yeah, we did have it recorded on a YouTube, and we'll make it available for all of you. I just have to get it from Paloma.
Okay. Give a
Demonstration
demonstration
of breathing. Do you want to do that, Jennifer? You feel comfortable?
Sure.
Okay.
So, oh, and I wanted to point out too, when you,
Yeah.
you said to put a hand here and then a hand on your
Belly button.
abs. That makes a huge difference for me because it helps you be aware of if you're moving the upper part of your lungs or not.
Yes.
You can't really see me. Okay, so I'm gonna walk us through it just one last time.
Yeah, so during the inhale, your eyes are closed and you're inhaling through your nose, and then you're either exhaling through your mouth with the use of your abdominal muscles, forcing the air out a little bit, and you're looking down with your eyes closed, and you can have your mouth open and purse your lips a little bit for an extra effort that actually opens the lung even more. So Jennifer, try that real quick. Inhale with your eyes closed but looking up. I didn't see the belly rise, Jennifer. Is your... It's hard to see.
Better?
Yes, better. Yes. So you want to see that the belly expand, and then with the exhale, you want to see your belly hand go in and actually use your abdominal muscles to force as much air out as possible. And the air can leave through your mouth or through your nose. Great job, Jennifer.
Yeah, just what I want is for everyone to see my belly.
Why do you think I can't zoom down? I'm embarrassed.
The quarantine 15, I've been
Yes.
hearing, is what we're all going to come out of this with.
Yes.
All right.
Hope that answered, Bill.
Great job. Thanks, you guys.
All right. Yes. Thanks, everybody. And everybody stay safe and healthy.
Thank you.
And we'll see you next week.
Thanks,
Really,
Russ.
really helpful. Thank you very much.
Thanks, everyone.
You all. Thank you all.
Bye-bye.
Looking forward to next week.
Thank you.
Thank you very much.
Bye-bye.
This was great.
Thanks for coming.
I'm trying to leave. It's not letting me.
Okay.
Hotel California.